after giving birth, there is so much to process. Having a baby can be overwhelming. It is not only about suddenly having another human in life to support, but the new mom's body also releases a lot of hormones that can affect mood. Women can experience a low mood and feel mildly depressed at a time when they expect they should feel happy after having a baby. But it's completely normal. Up to 80% of women experience what's commonly called the baby blues, often in the 3rd to 10th day after delivery. These are spontaneous crying fits, irritability, nervousness, and sleeping problems. These baby blues usually disappear on their own. However, if those feelings last longer than a couple of weeks, or if they become so intense that they interfere with woman's ability to care for herself or her baby, there may be an onset of postpartum depression. Postpartum depression is not limited to women. It may affect dads too. Today I am talking about different facets of postpartum depression. I'm a healthcare psychologist and therapist, and I make videos on psychology and mental health topics. Postpartum depression is a serious medical condition. It is thought to affect around 1 in 10 to 15 women. It can start anytime within the first year of giving birth. Most commonly, it begins between a week to a month after delivery. Sometimes the symptoms only start after a few weeks or when a woman stops breastfeeding or starts walking again. Postpartum symptoms tend to last for several weeks, months, or even up to a year or longer. Many women suffer in silence. Their friends, relatives, and health professionals don't know how they are feeling. Depressed mothers often feel very guilty towards their baby. They are afraid of being judged by society. As a result, half of the women do not indicate that they have a problem. Postpartum depression is not much different from traditional depression. The main difference is that postpartum depression involves another person, the child. If symptoms of depression last 2 weeks or longer within 1 year of giving birth, a person should receive medical attention. Postpartum depression is generally characterized by lingering and profound feelings of sadness or indifference or a strong, overwhelmed feeling. These feelings are present most of the time, in contrast to baby blues. In this state, it's extremely difficult for a new mom to see the light at the end of the tunnel, and this despair aggravates her condition. Tears after birth are to be expected, but if the new mother seems to cry constantly and will not calm down, she is probably suffering from postpartum depression. She has lost control of her normal emotions, and this crying is the outward expression of her inner problem. In addition, it is more likely that she will want other people to leave her alone. A sometimes paralyzing fear of being unable to cope with the stresses of parenthood and life in general, combined with a sense of unworthiness, can lead to a desire to escape from the challenge through suicide. While some women with this illness may have such thoughts, very few are going to attempt anything. However, even a remote possibility of self-harm must be treated seriously and precautions must be taken. A depressed mom may experience a lack or loss of interest in her baby. It does take time for the mother to bond with the child, even if she is not depressed. But for sufferers from postpartum depression, it is even more difficult. It's possible that she will not want to be involved in caring for the baby or even not want to see him or her. Sometimes a new mother can be very irritable and unreasonable and react with unusual anger to a seemingly innocent remark from a family member. In extreme cases, this anger may focus on the newborn. A deeply depressed mother can potentially harm her baby, and precautions must be taken if necessary. Other symptoms include poor sleep, regular headaches, and restlessness. Nobody expects a new mom to have an easy time getting to sleep. If she gets postpartum depression, she might often oversleep or be unable to make use of the time when the baby sleeps to catch up on her sleep. Some women can suffer from postpartum psychosis. This is a rare condition that can develop in the first 4 weeks after delivery. These symptoms are delusions, hallucinations, and distorted views of reality. This can make a woman think, for example, that her child is not hers or that she wants to harm her child or herself. Professional help in this case is always necessary. In the long term, postpartum depression has a negative impact on the child. He or she may suffer from developmental problems, problems with social interactions, relationship problems, and other health problems. Doctors do not know exactly what causes postpartum depression, but it can affect anyone. It's often caused by a combination of biological, psychological, and social factors. Biological factors include predisposition, changes in hormone balance, exhaustion, and a deficiency of vitamins or minerals. Genetic factors may play a role, and environmental factors may also contribute. Experiences or events that suddenly change life may increase the chance of getting depression. Having a child is such a life event. If something else drastic also happens, for example, the death of a loved one, stress at work or at home, and a move to another place, the risk of postpartum depression increases. Relationship problems or lack of social support during or after the birth are also risk factors. And sometimes the postpartum depression has to do with unprocessed experiences from the past. The chance of depression after childbirth is slightly higher if a woman already had depression in the past, if she had depressive symptoms during her pregnancy and in case of difficult pregnancy, and also if an unexpected medical intervention is required during childbirth, or the baby must remain in the hospital after delivery. Certain personal traits can make a person extra prone to developing postpartum depression, such as being unable to say no, perfectionism, and having difficulty expressing feelings. This social perception, like having a child is the best thing that can happen to you, can also play a role in the development of postpartum depression. This image can give a lot of pressure that can bring disappointment, but also shame, and you can feel like a bad parent. This can provoke feelings of depression, but it's important to remember, postpartum depression is never your fault. As many as 29% of pregnant women and women who have just given birth suffer from anemia. That is a shortage of red blood cells. Scientists have uncovered a link between depression and anemia. The women with anemia have a higher chance of experiencing depressive symptoms than the mothers without anemia. And iron deficiency is one of the causes of anemia. There is a link between iron deficiency and mood. People with chronic depression are more likely to have anemia and vice versa. Iron provides the production of a fatty layer around all nerve cells in the brain. This layer is necessary for communication between cells. In addition, Iron also ensures the proper functioning and development of a few important neurotransmitters: dopamine, serotonin, and noradrenaline. They are also important for communication between brain cells and regulation of emotions. If these neurotransmitters are out of balance, for example due to an iron deficiency, you can suffer from a depressed mood. So, preventing or treating anemia may reduce depression during and after pregnancy. Postpartum depression isn't just something new moms can get. New dads experience similar depression, the highest rates of which occurs 3 to 6 months after childbirth. The difference is there is no official diagnosis for postpartum depression in men. According to a study published in 2010, 1 in 10 men around the world experience paternal postpartum depression. There is an association found between low testosterone levels and depression by men. Why testosterone dips isn't yet understood. The cause of this depression in men is the same as in women. Depressed fathers are often dealing with feelings of being overwhelmed and not ready for fathership. However, there are additional complications when men suffer from postpartum depression. Men are less likely to seek help for their mental problems. Men are told to hide their emotions at all costs according to the social norm. But those feelings have to go somewhere. The responsibility of being a parent is probably even stronger by fathers, as they want to provide for their families. Especially after the birth of their first child, men have to deal with many sudden changes. The income of the family decreases and the partner relationship also changes. These factors provoke feelings of depression. If we ignore the hormonal factors, we can see as many risk factors for postpartum depression in men as in women. While the research confirms that male postpartum depression is real, the majority of men don't know about it. There has been too little focus on fathers, so it's important to help both fathers and mothers. Postpartum depression is treatable. Which treatment is best depends on personal situation. The first step is to accept that something is wrong and that complaints should be taken seriously. Talk therapy, such as cognitive behavioral therapy, can often help. Sometimes medication is needed, such as antidepressants or a sedative or sleeping pills. A healthcare provider can help a person understand the cause of a low mood after childbirth and can provide effective treatment and self-care strategies if necessary. In addition to the right treatment, there are also a number of things you can do yourself if you suffer from postpartum depression. Tip number 1. Take your complaints seriously and don't resist them. Ignoring them can only make the situation worse. If you take your complaints seriously, it will be good for your recovery. It can be nice if you can talk about your feelings with others. For example, with one of your loved ones, or seek contact with fellow sufferers. A psychologist is also a good listener and can support you in a professional way. Having a baby has a huge impact on day-to-day life. As a mother or father, you are allowed to make mistakes. We all make mistakes. It is an inevitable part of being human. Don't be too hard on yourself. And finally, try to rest. Let your partner or another close person also take care of the baby. This allows you to take time for yourself. That's all for today. If you enjoyed the video or learned anything, leave a like. And if you want to see more videos, hit the subscribe button and turn on the notification bell before you go. Leave a comment and share this video with your friends. Thank you for staying with me. See you next time.